The treatment of older adult patients is not simply the same as treating younger adults. Older adults have different barriers to recovery that have to be addressed. Treatment traditionally was designed for a fairly young population and tends to move very quickly and from early in the morning till late at night. This is sometimes not sustainable for older adults. Older adults come in with different levels of medical complications. An older adult with a substance use disorder is statistically much more likely to also have at least 2 other chronic medical conditions.
So the older adult unit became so valuable to me to sit with people of my age or older, to have an educated conversation about our kids, be able to talk face to face with someone who was my age. It meant a lot to me. I mean, it also brought my anxiety to maybe a non-existent level.
You know, it was nice being with people my age who pretty much had been through the same things. A lot of them had either lost their jobs, were retired, empty nest syndromes, or, you know, everything that hit them later in life. You know, I don't think I would have related that well with much younger people.
I wanted to be with people of my age. I did not want to be with the 20, 30, 40-year-olds. I could relate to people my age, you know. So I was very grateful that Hanley had a older adult unit for us. So, and I enjoyed that very much.
One of the biggest breakthroughs for me was going to the psychology department. I had no idea that psychology had anything to do with my problem.
We look at older adult mental health. Depression, anxiety, and dementia are the 3 most significant and commonly diagnosed issues in older adulthood, and all of those things can be caused or exacerbated by substance use disorders. It is imperative that with older adults you have the psychological ability, the faculty to tease out what is caused by substance use disorders or what conditions might be caused by other organic disorders and address them while they're there in treatment.
I would recommend Hanley to anybody. It's a dual diagnosis center. I needed a dual diagnosis center because alcohol and drugs were not my only problem. I suffered from depression. I suffered from anxiety. Alcohol and drugs were just a symptom of my problems. So I needed treatment for that. And that's what Hanley provides. You know, between the counselors, between the psychologists and psychiatrists, Hanley provides that. You know, if I can help one person, you know, come here or get sober, then, you know, I hope they would.
Hanley prepares me for a future. They gave me some tools to step off that airplane and basically go get them, Brian. You have an opportunity now. Go get them. And I'd say I've done just about every single thing they could say, because I've gone and got them, because I have my kids back. I no longer have congestive heart failure. I've gone to surgeries. I've done the step work. I don't have AFib anymore. I went through this horrible process of getting Hep C rid of. I got the medicine. It's gone. It's inactive. It's just wonderful. My business is flourishing. I treat my employees now as if they're my best friends. And life's, like the book says, is taking on a whole new meaning.
And I learned a lot. I mean, most people might think of rehab, you just sit there and you're not doing anything, but we worked hard. We had classes, there was instruction, there was education, the science of alcoholism, and I learned so much from it.
At Origins, we believe that every human being, regardless of their religion or their gender or their culture or their age, every human being has the right to the highest, best possible quality of life. As long as we take breath, our ability to connect to life in the best and highest way possible is critical, imperative, and a human right.